Right now we're seeing a continued uptick in the amount of fentanyl that our deputies are encountering out on the street. Fentanyl being introduced into the correctional facility. We had an overdose yesterday evening in our jail. We have vehicles pulled over on field access roads or on the shoulder of remote county roads where people are pulled over smoking pills in the vehicle. Fentanyl has got a nexus to a lot of what we do day in and day out, whether it's responding to burglaries and thefts and finding that it's people supporting habit or people that are suffering overdoses as a result of fentanyl use. We have not been able to get a handle on how to really decrease it or have a significant impact so far.
3 businesses were hit.
A string of early morning burglaries in northeast Portland.
City in decline.
Robbed and carjacked at gunpoint. This is not the city we once knew. Crime is skyrocketing, and the homeless crisis has reached a breaking point.
Sprawled on the sidewalk.
How and why is this happening in our city?
Portland.
The county itself is 718 square miles. We have a portion of the county that really is not heavily visited or utilized. It's a lot of private timberland and very remote, a lot of areas with no cell service. You can be an hour from your call or you can be 30 seconds from your call.
It's not hard to paint a story of what makes Oregon so special. We are a beautiful state. Where I live, I'm an hour from the beach, I'm an hour from the mountains. It's not hard to see the beauty of Oregon, but it is heartbreaking for me, the whole state. I mean, we have a crisis on our hands, and that's easy to see. It doesn't matter if you are, driving from the airport to wherever you need to go in Oregon, and you pass by the things that are happening on the streets in Portland. That is plain. We see that, but it's beyond that. You know, it's in Yamhill County. It's in my hometown.
High volume of overdoses along this stretch of Marsh Lane. There was one here yesterday.
We have a homeless crisis, we have an addiction crisis, we have an affordability crisis, we have a workforce crisis. It's like playing whack-a-mole, it feels like right now, with the number of challenges that counties are facing. Some of them have been ongoing. Some of them have compounded, and then I would say in the last couple of years, some have really become exacerbated because of new policy. Measure 110, as an example, is something that has really thrown all counties into the throes of crisis.
Too great of a distance for people in the rural parts of the county most of the time to be able to access those services with any degree of regularity or certainty. Is just challenging when you're dealing with things that are spread out over a large area to get people connected to those services and keep them engaged with it.
It's affecting actually every part of the generations in Oregon. I'm seeing it from the elderly, and I'm seeing it all the way down to our youth. In Willamina, we had someone was smoking fentanyl in the high school.
The deputy went into the school, or went into that building and checked the room, and within a very short time suffered ill effects. The deputy, as well as a couple of students, had to go to the hospital for some medical treatment.
In any community, that is tragic, but in a small community of less than 3,000 people, I mean, that sent alarm bells ringing. So we have drugs that are just rampant, and we're seeing public drug use daily. We are seeing extreme homelessness and garbage everywhere. It's unsafe and it's unsightly, but it's also heartbreaking because literally our fellow citizens are dying. What are the community leaders in my district, in Yamhill County, what are they wanting? You know, they want to see the governor's 10-point plan go beyond Portland. They want to see it get to all of Oregon, specifically Yamhill County, where we're needing some help. And they want to see that we're going to do something, and they're crying for that. We need to see that things are going to change.
Portland. Down in Portland, Portland is going to change with it.
In case of Multnomah County and City of Portland.
Things in Portland. We know that our major city has to be successful.
This work is going to be critical for the next 6 months to show not only the state, but the nation that Portland is turning a corner.
I completely agree with my colleagues in the rural areas of Oregon that they've been left out. I know that the governor's job is to provide statewide policy, but that doesn't work in our communities because rural and urban communities are very different. They're funded differently, they operate differently, culturally they're different. They have not asked rural counties, rural providers to come to the problem-solving table to really look at what solutions are, which means there's going to be significant gaps. And that's the space that we're in. And that is the frustration of these rural commissioners. And when I say rural, it's not even as far as Eastern Oregon. It's literally Yamhill County, which is right across the river from me.
When the focus is always on the major metropolitan area, you do have probably a greater impact to an extent because you have such a higher population concentration. The problem is that the drugs don't distinguish between a user in downtown Portland and a user up in the rural part of the county. They have the same jeopardy of overdosing and dying. Whatever efforts they make, recriminalization, law enforcement assisted diversion, criminalizing or allowing cities to enact ordinances that deal with public consumption, much in the same way we have with alcohol and marijuana usage, those need to be something that really is good for the entire state, not just for the Portland metropolitan area. We deal with the same problems that they do. It just looks a little bit different out when you're spread out over a large area.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.